Welcome to The Big Picture. I'm Phil Arno. On this big picture, I have the privilege of speaking to Dr. Raul Vasquez via Skype. Dr. Vasquez is well known in Western New York for his work with the Hispanic community and his use of technology in the treatment and for the convenience of his patients. He's very knowledgeable about the coronavirus and the situation we've all been going through. Dr. Vasquez, welcome to The Big Picture. And I see you have one of your patients there who I understand just happens to be your daughter, Nadia.
I thought I had the flu, and everyone else thought I had the flu because I didn't go anywhere, nor have I been around people that have been exposed. So the high-risk areas were Italy at the time and China. And they said because I wasn't there that I shouldn't have the coronavirus, so they didn't suspect me of having it.
And then she went to, she ended up getting worse, and we had her go into one of these urgent care centers.
Yeah.
And there she was tested, and she was given a round of antibiotics, and that was the extent of the follow-up during that time. She was very concerned about the tests and kept calling back, but the Department of Health hadn't really been, they didn't have systems in place to kind of manage on this. I noticed that about four or 5 days later, she still continued to spike temperatures. And you were having temperatures of 103, 104, and she's on around-the-clock Tylenol and Motrin. So we're trying to knock those temperatures down, but it still wasn't working quite well. When she started complaining of chest pain, she's more of a doctor than I am. She went in, and we were able, at the immediate care, to get the x-ray to show the infiltrate. I think at that point, by getting treated, we figured so now we put her on this precaution, whether she was COVID-19 or not, as having this. So she stayed in her home and was confined and went through the stuff, but she wasn't getting better. And I think because she wasn't getting better, I got a little more concerned, and over the weekend, was it Saturday? Sunday, I said, you know what, you got to go to the emergency room, because I knew she had the infiltrate and her temperature, she just wasn't doing better. When she went in, we ended up kind of looking at her labs, because we weren't able to get labs at the urgent care. They don't have those things. And the labs, to me, kind of almost looked like she had a left shift. By that, I mean that it looked like it was more bacterial infection. So we ended up admitting her to the hospital, treating her for a bacterial pneumonia in addition to that, because we didn't have the test yet while in the hospital. She was treated with the Levaquin IV, and she started to respond. Her temperatures came down, and she started to get better, to the point that from there, she was discharged home, and we brought her to the house, but we isolated her in an area that she basically just there. We were passing food. We were following all the universal precautions for her. And my wife and my sister-in-law have been really, really, I think they've been nurses through this whole process. They had the Lysol, the cans, the mask. I mean, it was something I've never seen before. But it was almost like a hospital structure here. And I think that was important. Her sister, too, who was a medical student, helped through the whole process. But let me just tell you. So then we got the results. Was it 16 days later?
20 days.
20?
No, yes, 16
days later, which about 4 days ago.
Yeah.
She came back. The Department of Health called her and said she was positive. But during that whole time, there was really nothing that they did to kind of let us know. And then the protocols were, once you're positive, if you're afebrile for 72 hours, you pretty much come after the quarantine, especially because she's been in this for 16 days.
And because I was not in the high-risk areas, they kept saying that I had the flu.
Right.
They didn't believe that I had anything else.
So, and because she came back as positive, what does that mean for you and your wife and other people who were exposed to her during this time?
Yeah, no, it tells you, well, the thing is, she's positive with symptoms, which is what the important thing. Most of us, I mean, Erie County, I mentioned this about 4 weeks ago, we probably have about 150,000 people that are already infected and moving this thing around. So it's sort of like everyone right now should think that they're positive. I mean, it shouldn't be sort of like waiting to get tested. The precautions have to be taken now, especially the peak. And we're in the peak now. This is the peak. I said, in New York City, the peak is here and next week. For Buffalo, you're going to see the peak a little bit later since we didn't do the testing as much. Probably 2 to 3 weeks is when we're going to start seeing a lot of this. So when patients see the rise in numbers and death, they shouldn't be, overly concerned. Just follow the precautions and maintain social distancing. but we're almost to this mountain. But when you see the mountain, you might get a little scared.
You know, I'm a little confused because if you say that we should all assume that we're positive, and certainly in your case, you've been exposed because you were there and she was positive, so we know that. Is it possible that you are positive with that virus, but you will go through this whole process and never exhibit any symptoms or get sick?
Correct. 80% of people will actually have it and really, well, if they get small symptoms of a cold, get over it. So there is 80% of these individuals that are actually going to get better. But you have that 20% that you've got to. So if you're dealing with someone like older, over 50, that has respiratory issues, it have a problem. So COPD and asthma, you have a problem. People that smoke, this is a good time to kind of really get that message across that because you smoke, you're at higher risk. People that vape, anything that compromises your airways, so when you get exposed to this virus and it allows it to really flourish, is what you really have to be concerned about.
So to be clear, you have been exposed. You are assuming that you're positive. You go the next 2-3 weeks and you don't exhibit any symptoms. Are you going to assume that you've been positive and you just basically, your immune system fought it off? Is that how it works?
Yeah. Well, 80% of people, once you get this infection, you're going to build antibodies. And those antibodies against that virus is, so you won't get the same virus again. Okay, so once you're over this, you're done. But next year, these RNA viruses replicate and they change a little bit. So your immune system, if we don't have a vaccine by that time, may be exposed and go through this whole cycle again.
Can you explain to me one thing, and I'm thinking maybe a lot of people have this question, with the way things have been affected by this, the economy, everything closing down, people staying at home, why is this any different or any more dangerous than H1N1 was in the past, or the Ebola, or any of the other flus, the common flu that kills arguably many more people every flu season than what we're hearing about now with coronavirus? How is this any more dangerous, and why?
I think one of the things that happened, and everyone's talked about, is CDC usually keeps better surveillance on this stuff, and there was some dollars that were taken away from the CDC. So you're not kind of seeing things earlier, but by January we knew there was something going on. So it's just about surveillance. With this stuff, surveillance becomes real important in terms of areas that now we're going to look back at this and kind of learn from it. But areas that have a lot of traffic coming into the country are going to be kind of exposing us to a lot of these particular issues. That's where New York and Florida and California are going to be hotspots, because people are traveling to these areas that actually brought it. And this particular, the difference about this virus is it's contagious and it lasts longer. So I mean, if it's on plastic, it can last for 3 days, and stainless steel for 3 days. So if you're in an area of the subway system like New York and everyone's touching this stuff, everyone's going to pretty much pick this thing up, and it's going to have, and not knowing, you're going to pass it on to someone else at a later stage. So you may have it, and then 5 days or 6 days or 7 days, someone else gets it. They start their cycle. They're starting their 2 week to 3 week cycle of processing this virus in their system.
So in terms of the actual nature of the sickness, of the disease, compared to Ebola or the H1N1, that's different?
Yeah, this one's more contagious than that. The other ones were, but not to the extent of what. And the thing is, it just started spreading to the point that carriers were asymptomatic. So you got people that are walking around basically giving this to other people without having the symptoms. So they assume everything's okay.
Putting it in perspective, is this more deadly than Ebola or H1N1 or the typical flu?
Well, it's more deadly than the typical flu. I mean, the reason is because your body hasn't really been exposed to this. Remember, that's the biggest problem. With the flu and the vaccinations that we have, we're able to kind of protect against influenza. And the nice thing is, influenza lasted a little longer this year than normal, but we make vaccines for the different types of influenza. But this year, B, which is not the one we mostly vaccinated for, we vaccinated more for A, actually came out, and we were seeing more of that. And I think with with this coronavirus, there was like a mixture of all that stuff. So, but the flu, if you look at the state data, is coming down drastically. So now anything you see that has these kind of symptoms, you got to assume that you're playing more in viruses like corona.
Now, I want to get back to your daughter, Nadia, for a second. She was not in a high risk area, or she was in a high risk area and then became infected.
Well, the only risk I could say is a student. She's a student, so she's around other students, and she's at the UB school of the South Campus post-bac program, and so just around students. That's it. Because I mean, she's studying, and they study about 10 to 12 hours a day, so it's a little bit different.
Have other students that were near her been tested positive to your knowledge? Do you know?
No. As soon as I got sick, I started to isolate myself because I thought I had the flu. So regardless of what I had, I didn't want to give it to anyone else. So when I did get sick, I just stayed home. So I didn't get anyone sick, hopefully.
So somebody could have been positive and not showing any symptoms, as we just spoke of, and basically infected people around them. It's almost like, I was in a lecture some years ago, and we had probably 30 or 40 people in the room, and the person who was giving the lecture said that maybe 2 or 3 people in the room had a cold and exposed everybody in the room to that cold, but not everybody was going to get that cold, and because immune systems are different, vulnerabilities are different, and they're all exposed, and we all might, be getting that virus, but different people are going to fight this virus off because of the immune system. And basically, I guess that's what you're saying.
That's what, but it's affecting young people. You're seeing a lot of young people also getting this, and I think a lot has to do with the smoking and the vaping, compromising their airways to really make this virus kind of flourish. But I think that the players that are at biggest risk are people with chronic lung disease or heart failure patients, diabetics, because they have their immune systems, it's compromised. So you get a virus.
Yeah, I read that men are more affected than women. Is that for the same reason, do you think?
Yeah, we don't go to the doctors much.
Good point. We need to take a quick break, and it's a very interesting conversation. Everybody stand by. We'll be right back after this. Welcome back to The Big Picture and our Skype conversation with Dr. Raul Vasquez. Let's get to your practice a little bit. You have the G Health Enterprises, okay?
Correct.
You reach out to people. They can call a hotline and talk about symptoms and get information about this. I'm going to get the hotline number on the screen. We're going to put that up. I think it's 716-604-0504. And people can call that hotline. What will they get when they call the hotline?
Well, we were proactive. So we took a list. We actually switched to a whole telehealth model. So we've been virtual for the last 2 to 3 weeks, and we knew the storm was coming. The worst thing you did was to go to the doctor's office and ER. Anytime that you went to a health facility, you could assume picking this thing up because the infection rate was going to be huge. So we decided to switch to video calls and process those calls as they came in, and really give people the advice and the comfort that this is what we're going to do. We weren't able to get some tests. We're finally getting some tests now. So we're going to be doing some testing for the individuals we feel actually carry the most risk. And those are going to be the ones that have the fevers, the cough, and the shortness of breath, especially for COPD and high blood pressure and heart failure, because there is treatment, and we're going to try some of the treatment in those individuals that we can monitor. And they talk about the Plaquenil and the Zithromax. We want to see if that works within that patient model. And what happens here is we can't write the scripts unless we test people. So it's like a catch-22. So we want to be able to test the right people, put people on the right medications, and see how well they do. So we're not all going to the emergency room to pick up these medications, because these systems in the hospital system, the Department of Health, were not equipped for these types of germ warfare that we're going to be running into. And I think we'll have to learn from that. But your primary care physicians with the telehealth can screen people. And in some cases, if it gets bad enough, you almost make like a virtual visit where the doctor doesn't have to be there and the equipment can give you all the information you need.
When it comes to testing people, you said that people with symptoms would be the ones to be tested, or people at risk.
Right.
How do you qualify to be tested?
I think you want to know who's going to benefit from treatment. So that's how we look at it. So if you're a 50 COPDer and you got these fevers and you have the shortness of breath, we're assuming that it's affecting your respiratory system. So these are the individuals that we really have to watch, because if we don't watch, they can get into trouble. And these are the ventilated cases that we may be able to kind of either plateau those individuals by treating them with the medications. But remember, the good thing about the medications they're talking, while they do have some side effects, these are meds that we've been using for years. The Zithromax, we've had hundreds of thousands of people on it. And the Plaquenil, the lupus patients, we had hundreds and thousands of people on it. So it's not, these are not drugs that are that dangerous. I think the condition, if you run into having such a high risk, these are the individuals we feel need to be treated.
There's so many different things that are going on, and this changes day to day, almost hour by hour. I've read just recently that I think it's at 100,000 people in the New York City area are being given the chloralquinine malaria drug, not as an official test, but for all practical purposes, it's going to be a test to see how it works with that large number of people. What do you know about chloralquinine and how it's been used and the success rate? Is that something we should hope for?
Yeah. So the Plaquenil, I always remember, it's easier for me to remember Plaquenil. It's the same thing. I think what you worry about with this particular drug, the biggest side effect is it can affect the heart. There's a QT, which is the way that the electrical system in the heart kind of works. It can expand that a little bit, and patients that have arrhythmias can develop arrhythmias if they're on this product. So you have to watch who you're prescribing this for, but most of the people we're putting on, they would have had an EKG, they would have had some sort of a finding to make sure that they're not candidates. How this drug interacts with other drugs that may affect that is what you got to look at. But I agree. I think it's been used, but in a small amount, 20, 26 cases. That's the kind of data we have on it. But when you get to the case where you see all the body bags that we're having, if you have something to try, it doesn't hurt to try it early on in the course.
Now,
I don't have a lot of experience, and I don't have a lot of experience because we have about 150 people that need the treatment that we've been monitoring, but we can't get the test. We didn't have the protective gear, so we're kind of stuck. And now that we're getting some of these tests, we're going to do this sort of walk-through, drive-through to test some of these individuals that may benefit from the medications to be able to catch them early.
Well, the chloralquinine is everything. I haven't heard anything negative about it. I mean, I'm not sure whether I'm only hearing the success stories. I've heard some of those. Is that a common drug that is available? So if that does prove to be effective, so that would be a good solution if it does come out positive.
Yes, it is a good solution. The problem you got right now is, again, we use it with lupus patients. So we've used it with lupus patients for a long time. The pharmacies are kind of saying if you're not positive, your insurance doesn't cover it. So if you have to pay for it, it's going to be quite expensive for a lot of people. So, the president and a lot of people are saying they're dropping in large amounts of these medications within our system. But what I'm saying is I'll have a better idea on this once we test people that we felt had the issue and whether we treat them and how well they respond to the treatment. So that's coming soon for our office. The thing here in Buffalo is we're about, like I said, New York is here next week in terms of its peak. We're not going to be peaking for another 2 to 3 weeks here in Buffalo because we haven't had, the amount of, I think the social distancing helped but you still have a lot of these individuals that are carriers that are being exposed, that were tested, that didn't know they were positive. So we still got a little bit on the storm coming for us.
Interesting. Now you are well known in the Hispanic community for serving the community and helping out. How is the virus, how is this whole situation affecting the Hispanic community in Western New York?
Well, if you notice where most of the cases are being diagnosed, it's in the city of Buffalo. Out of the 400 plus cases, 130, 140 are in the city.
The culture, much like the Italian culture in Italy, and I had a guest on, we talked about our heritage. The Italian families are very close, and the elderly and the young associate. It's not like, the kids get their iPads and go, off and play, and the adults are left alone. It's very much the same in the Hispanic community as well. That's something that kind of exacerbates the situation, isn't it?
Yeah, it does. And so my mom is 82 years old, and she lives with me. So during this time, we moved her to a separate apartment. So when I brought my daughter here, we assumed that she was positive. My mom, I only FaceTime my mom. Yeah. And if she needs something, we go over there, but everyone's kept away from, she has no interactions, which is kind of sad, but I'm FaceTiming her 2 or 3 times and figuring out, do you need anything? We'll drop it off. And I think that becomes real important during this time, because that's the generation that can really get hit with this thing.
Well, that's the prime consideration, is to protect the elderly and the people who have that underlying medical condition who are at risk. I mean, the consequences for younger people are not all that great, but the consequences for those people at risk, that's who we have to protect. And it's such a, as you've talked about, people can be carriers and not have this, symptoms, and so that's what, it's almost like a stealth disease, and that's really tough to fight against.
Yeah, no, that's where the problem is. We've had a lot of stories of people that just, we've had patients. I had a 60-year-old patient that is a patient of ours. Her son wasn't a patient of ours. He went, a 40-year-old, it's an elective procedure. Once he went in, he started getting a fever, ended up testing positive, ended up on a ventilator and actually died, So, I think if you have elective procedures now, it's not the time to be in the hospital. Unless you feel you have these symptoms, at least for the next 2 to 3 weeks, hospitals are not the place that people should be going.
You're going to change direction just a little bit here. In your practice, you've used what they call telemed technology. Can you explain a little bit about that? Because I want to have people understand what telemed is.
Yeah, so telemed, there's a lot of different levels of telehealth. What we end up doing is, so if you call the doctor's office, it's almost like this that we're doing right now, the Skype visit. So there's a link that gets emailed or on your phone, and then you click on that link, and what we're doing right now is what happens. We can exchange information. I think patients like that, just like this interview is a little more personal with a video than a voice. And we can basically show the patients, they can take pictures of things or rashes and basically get that information back to the doctor. There's also some, on the next level of telehealth is Title Care, which we were waiting for protective gear. We can have what we call navigators go out to the patient's home. And with equipment that gets put on them, we can listen to their lungs, we can get their blood pressure, we can have video of their, video of their throat, ears, basically almost doing an exam like you were in the office. And that information comes over to the doctor, and we make the recommendations based on that. So we manage a lot of our patients with more chronic diseases. So you remember, if you have COPD, if you're over 50, the last thing you want to do is go to the doctor's office right now, because all those barriers that you got going in, you may be in a cab, all this, that gets taken away, and we're right at the person's home doing a lot of these things. And if they need the meds, they get delivered, but you're helping that individual not be exposed during this time.
Okay. Well, we're running out of time now, and we'll put your hotline number up again. But as we wrap up, what's the single most important thing that you can advise people, for the foreseeable future, the next few weeks, while this is all going on, in terms of helping and preventing best case to help in this situation, stay healthy and protect their loved ones?
Yeah, I think the biggest thing is social distancing is important. But while you're home, assume that everybody in the house has it. So keep the distance even in the home. If you have one bathroom, make sure that it's being cleaned, disinfected after everybody uses. Don't share towels, cups, okay? And disinfect things like their phones and different furniture at the time during the day. Wash, your clothes often. Don't do, kind of change your pattern there. In addition to that, open your windows. And if you run into the problems that we tell you to call for a nurse line, is really if you start developing sort of this fever, cough, runny nose, and in some cases, what we found, which is strange, is the loss of taste for sweets and salts. So there's a loss of taste. Then these are the individuals call the Department of Health. If we have our number out there too. If you don't have doctors, you can call our numbers 604-0504. And we will kind of give you more instructions as to what you should do during this time. But again, the things to do in the home are real important.
Dr. Raul Vasquez, thank you very much. This has been very informative. Once again, that hotline is 716-604-0504. Thank you so much for being my guest. The best to you and all your patients, Dr. Vasquez. We'll check in with you again. I appreciate so much for you being here. And for everybody, that's all the time we have for The Big Picture this night. Thanks so much for watching The Big Picture. And again, thanks for watching WBBZ-TV. We'll see you next time on The Big Picture.